Exactly.
Suggestion.
Exactly. What I am saying about the menu of services is I actually prefer that the menu of services be, and this is my take on it, be shortened and you really focus on what you like doing. Here's one of the things that will happen. If there's a price difference, what do consumers notice? They might not know what myofascial release is, but they know the difference between 80 and 60. And often they're going to choose, well, right? But what do you want to do? A lot of therapists I work with, so in Fernando's case, if Fernando decides he wants to do mat work, he takes the mat class, he's come to the Thai massage jam, he's done some table work too, but he decides he wants to do mat work. This is how I tell students to transition the clients from the table to the mat. This client has come in for 6 months. They come in and get a session once a month. Why are they going to switch to getting on the mat? You sell it, which means you have to offer it first. What I tend to do, or what I recommend, if you work for yourself like Fernando does, if he can put down a mat and he says he really wants to do mat work, he really wants to successfully transition this client to the mat, do you find that table work is more work or mat work is more work?
Well, the table's going to be more work.
Do you actually feel that? Like is it more physically intense?
Yes, my hands,
Yeah.
and then just lugging around the table.
So if he wants to do less work, here's what I'm going to tell him. You take this client on the table and say, listen, next time you come in, I'll give you 90 minutes on the mat for the same price I charge as an hour on the table. What does the client hear? 30 minutes of free massage. Oh, I'll at least try it. Now, once he gets on the mat, how's he going to feel?
Hopefully, he'll notice the difference.
And the thing is, if I go in intellectually, and I go in like, well, it allows deeper compressions, and you sell the features, that's not really resonating. But if we resonate with his pocketbook, like he would want an extra 30 minutes. I mean, enough to at least try it, right? That's the way I recommend you transition people. I know you can't control the menu of services at the place. What I recommend you do is become a specialist. In other words, who makes more as a doctor, a general practitioner or a specialist? Specialist. Okay, so are you a massage therapist or are you doing soft tissue work? Myofascial release. You see what I mean? You can do that legally. You're using the same license, you're just specializing in a specific area of work. Make sense? When it comes to the menu of services, you're going to have to work that out with your boss. And if you're anything like me, you try not to ruffle feathers.
Try to ruffle feathers.
I've been fired from a lot of jobs.